I can start there. We covered how digestion works, and we named the specific conditions like IBD, colitis, and leaky gut. Today, we heal them. One honest note before we dive in, because I always tell you the truth. This protocol works often and it works profoundly, but it does not work for every single case. Some pets need advanced veterinary intervention alongside this, or instead of it. Keep that in mind as we go along. Let's get into it. Everything I'm about to teach you comes down to a single framework, adapted from functional medicine and blended with traditional Chinese veterinary medicine principles for companion animals. It's called the 4 R's. Say these with me: remove, replace, reinoculate, repair. Here's the one-line promise for each before we go deep. Remove what's hurting the gut. Replace what's missing. Reinoculate with beneficial bacteria. Repair the gut lining itself. The first R is remove. The goal is simple. Eliminate what's actively feeding dysbiosis and irritating the gut lining. Start by identifying and removing problem ingredients. The common triggers I see most often are chicken, beef, dairy, corn, wheat, soy, and artificial additives. Next, address unnecessary medications where it's safely possible, always in consultation with your vet. I'm talking specifically about NSAIDs and unneeded antibiotic courses. Then, address any underlying pathogens directly: parasites, SIBO, yeast overgrowth. These need to be dealt with before the rest of the protocol can fully do its job. And finally, reduce environmental and dietary toxin exposure generally. Think of this phase as clearing the runway before we build anything new. The second R is replace. The goal is to restore what's missing so digestion can actually happen mechanically, not just manage symptoms on the surface. First, digestive enzymes. Protease, amylase, and lipase, especially important for EPI or for aging pets whose natural enzyme production has declined. Second, hydrochloric acid or HCl. This is support for pets showing signs of low stomach acid, bloating or undigested food visible in the stool. Third, bile support for pets struggling with fat malabsorption. I like to frame this phase this way. We're giving the digestive system the tools it's currently missing to do its job. The third R is reinoculate. The goal is to rebuild the beneficial microbial population that's been depleted by dysbiosis. Start with multi-strain probiotics. Here's guidance you can act on today. Look for Lactobacillus, Bifidobacterium, and Enterococcus species, and check the label for guaranteed CFU counts through the end of shelf life, not just at manufacture. Next, prebiotic fiber to feed the beneficial bacteria you're introducing. Inulin, psyllium, pumpkin, and chicory root are all good sources. And fermented pet-safe foods can be a gentle additional source. Important pacing, and I say this every time. Introduce this phase gradually. Going too fast can cause temporary gas or loose stool, and that scares people off the protocol right in the middle of it. Slow and steady wins the race here. The fourth and final R is repair. This is where we heal the gut lining tissue itself, not just manage what's living on top of it. L-glutamine is the cornerstone here. Think of it as the primary fuel source for intestinal cells, directly supporting tissue repair. Bone broth and collagen support the gut lining and soothe the mucosa. Soothing demulcent herbs, slippery elm, marshmallow root, and DGL, which is deglycerinated licorice, calm irritated tissue. Omega-3 fatty acids from fish oil provide anti-inflammatory support throughout the gut, and zinc carnosine specifically supports tight junction repair, directly addressing the leaky key mechanism from video 2. Put all 4 R's together and you have a complete sequential approach. Clear the runway, restore the tools, rebuild the population, repair the tissue. Now, let's put this on a calendar. Weeks 1 and 2, remove triggers, simplify the diet to a limited ingredient or elimination base, and begin enzyme support. Weeks 2 and 3, fully dial in the replace phase. Enzymes and HCl are biosupport at full dosing. Weeks 3 and 4, begin REINOCULATE, probiotic and prebiotic support introduced gradually. Weeks 4 through 6, layer and repair. Glutamine, bone broth, soothing herbs, omega-3s, and begin careful one-at-a-time reintroduction of foods to identify true individual sensitivities. Week 6 and beyond, transition into a long-term maintenance plan. That's exactly what we're covering in video 4 next week. And this is important. This is a framework, not a rigid calendar. Pets with more severe, long-standing dysbiosis may need to move through phases more slowly. And in practice, the phases often overlap rather than following strictly in sequence. Let's reconnect to traditional Chinese veterinary medicine, which we introduced back in video 1. In TCVM, digestive health is governed by the spleen and stomach systems, and the goal here is threefold. First, strengthening spleen qi to improve the transformation and transportation of nutrients, addressing loose stool and post-meal lethargy. Second, descending stomach qi to resolve nausea, vomiting, and reflux-type symptoms. Third, resolving dampness, a common root pattern behind chronic loose stool, bloating, and greasy or gunky ears and skin that so often travel together with gut issues. Your practical takeaway? Use warm, cooked, easily digestible foods. These are generally favored over cold or raw foods for pets showing spleen qi deficiency patterns during active healing. That's the full protocol, the 4 R's, the 6-week timeline, and the TCVM perspective, tying it all together. Grab the full written protocol and food list in the members circle if you have joined. Link is in the description. And next week, we're going to talk about how to make this stick for life, plus a recap of insights from our live public Q&A. This protocol has produced some of the most dramatic transformations I've seen in 20-plus years of practice. Pets labeled sensitive stomach for life, who fully healed. Come on, subscribe so you don't miss video 4, and I'll see you next week.